Hey, coding team, how you doing? This is Dr. T. Continue with the review of the urinary system. Here we have in the present slide, medical condition called hydronephrosis. What is hydronephrosis? Hydronephrosis accumulation of fluid in kidney tissue. Which is the fluid is urine. But please keep in mind, urine is basically sterile. So basically, there's not going to be urine in the kidney, and even urine in the urinary bladder. It's not expected to have any kind of bacteria. So, okay, let's go back to this urine accumulation of fluid in the parenchyma, in the kidney. What's happening? We have an obstruction, patient having an obstruction. This is going to be blocking the normal flow of urine in the urine collecting system. So now we have what? Accumulation of liquid. The problem with this accumulation of liquid is it's going to be putting pressure on the tissue. And that tissue is going to be going to a state of atrophy, literally. So eventually, this patient is going to be presenting a renal insufficiency. Eventually, this kidney is going to be totally destroyed. Now, if this accumulation of fluid is produced, if this blocking is produced by a kidney stone, okay, the kidney stone produces a lot of pain. The kidney stone produces a lot of problems. So that's gonna be removed. But keep in mind, if the patient is having a kidney stone, most likely is going to be having more kidney stones. Now, what we have in here, again, the definition, hydronephrosis, buildup of fluid in kidney tissue. This accumulation occurs obstruction in the flow of the urine collection system. Stones, medical terminology, hydroliquid, nephro, kidney. Now, oocyst, medical condition. So now, what we have, diagnostic codes. Yes, our most important part, diagnosis codes. N13.0 hydronephrosis with the ureteropelvic junction obstruction. Okay, that's a nice diagnosis. But when the patient is coming to the office first time, we're not going to be using this one. We're going to be using N13.30 on a specified hydronephrosis. In some cases, N13.39, other hydronephrosis. But keep in mind, using the other diagnosis, that's going to be a little more difficult. So let's go back to N13.30 on a specified hydronephrosis. Some bad cases, babies, Q62.0, congenital hydronephrosis. Now, when we go back to a final diagnosis, now we have two other options. You know, these are the most common, most frequently codes used. N13.1, hydronephrosis with ureteral stricture. Now, we were talking about the stone, remember? Now, what's happening? The stone produces a lot of pain. That stone is going to be removed. Now, as a consequence of that stone, there is some damage in the ureter tissue. So what's going to be happening? That damage in the ureter is going to be producing a little scar. That scar is going to be producing a stricture and stenosis, reduction of the diameter. So now we have another problem. Now, since the diameter of the ureter is going to be reduced by half, by 30%, you know, everything depends on the region of the stone and the type of the lesion and the time to remove the stone. There are many factors on that one. But anyway, now what we really have is a stricture that's going to be producing a decrease in the flow of the urine, and now it's going to be producing accumulation of fluid in parenchymal renal tissue. Now we have, again, hydronephrosis. Now, this hydronephrosis eventually is going to be producing renal insufficiency. That renal insufficiency is going to be progressing and progressing and progressing. Eventually, the kidney is going to be in a full state of atrophy. Kidney is not working. You see, this is hydronephrosis. This is this part of the urinary system. As mentioned, we will view this one this time. Continue talking about this one. Hey, nice to talk to you. Take care, coding team.